Hi, I'm Dr. Rajani. Thanks for joining me today. We're talking about the truth. We're going to go through a transformation, taking someone from looking like this to looking like this. And we're going to talk about it. I'm going to show you the injections. I'm going to show you what was done. And at the end of the video, everyone always wants to know, how much does it cost? I'm going to go through a breakdown of what something like this would cost. Of course, how does it apply to you? Everyone's face is different. Everyone's needs are different. But understand, it's controversial because a lot of people have a lot of emotional feelings about this. And I'm going to talk about that really quick at the beginning of the video. We're going to have fun today. If you agree with it, great. If you're doing it, wonderful. If you're threatened by it, comment at the end. If you don't want anything to do with it, comment at the end and let us know why and what your thoughts. Let's talk about it today. The truth about facial transformations. Okay, so we have social media now. We have stars on the red carpet. We have Instagram and of course YouTube here, and you can see who gets a lot of likes, who's very successful in their channels, in their Instagram. People make a living from this now, and they get paid very well to be not only YouTube stars, but Instagram influencers. And many people that watch this channel, of course, have med spas. We have a lot of patients and a lot of people in between. But if you own a med spa or an aesthetic business of any sort, you likely have these people who are called influencers. So you're using them and paying them in some way. People are threatened by it. They don't like it. They might not agree with it, changing facial structure and shape. A lot of people come into these clinics and they say they want to look natural. And I just think they're not in touch with what natural is. If you're wearing makeup, if you're coloring your hair, if you're styling, then you're not natural in a sense. And we could argue that point, but when it comes to fillers, people all of a sudden retract and go, oh, but that's where I draw the line. And who says? The younger generation, I can go weeks with seeing people from 20 to 35. It's the #1 demographic coming into these places, and it's for a reason. It's valued, and a lot of people come and say, I want to be like one of the red carpet stars. I want skin like them. It happens with every other patient that walks in. Okay, if you do, here are the steps that you do. Neuromodulators, fillers, lasers, take care of your skin, skincare. But people seem to draw the line at fillers and toxins, and they are almost threatened by it at that point. What's the difference? People who get these treatments done tend to make more money, get better jobs, be more successful. Studies show this. I did a video on red lips attract. And we also know that jaw lines, for males especially, they're more successful. But certainly look at the red carpet stars. They often have a beautiful chiseled jawline with a great gonial angle for the female. So these are known things. So I want to go into the treatment. We'll show the injections. Feel free to comment at the end. And this is what would be a typical day in an aesthetic practice. Very rarely does anyone come in now and just do neuromodulator like Botox or just get a filler. Almost everyone's a combination, and it's all the rage, and you know this because I've been talking about it for 10 years. Go back to my first videos. It's all about combinations. Let's dive into this one today. Okay, so the first thing we're going to do, very basics, we're going to use some Botox here at the downward fibers or the orbicularis oculi. This is for a lateral brow lift. Just about everyone loves the lateral brow lifted. The patient doesn't even really feel this. It's very superficial. We just use a small dose. It's just 3 to 5 units per side. Almost everyone's going to get PDO threads if they're getting neuromodulators. And here's a twist coil type of thread. It's 1 inch long. Why I'm doing it, I never want to have to Botox above the brow in the frontalis here, because the only thing that toxin in the forehead can do is lower. And look at her beautiful arched brow here. We don't want to stop that. We don't want to ruin it. And if we do this now, she'll likely never need neuromodulator in the forehead if she does retin-A's and skincare. Still doesn't really feel that much. These are very minimally invasive. Now remember, threads, don't draw water in. It's not going to look unnatural. That's why we're coming down here and I'm putting one in at the vermilion border. Some people call it the PDO lip lip, but very happy with her lips, has great shape, but she just wants a little curl at the border. She can do it because she's young. Everything looks good. An older person, if the skin wasn't rejuvenated, if there wasn't good cheek projection, the eyes didn't look good, you don't want to have an unnatural looking lip. So the next step here, we're going to do cheek filler. All we're going to do is a half a vial of hyaluronic acid filler per side. They get excited when you do this. And what we're going to do is we're going to change her point of maximal light reflection to be just a little bit lateral to where it is now. It'll also lift the face a little bit. It'll contour. It'll create a slightly narrow looking illusion here. We're using a micro cannula. We use mainly 22 gauges, and I use a cleanser on the sterile 4x4 so that we can protect any bacteria from the hair. And I'm going through with that micro cannula just back and forth, and I'm watching it fill. As we watch it fill, I know where I'm going to go. You can never tell. Is it one vial? Is it two? Is it half? I can guesstimate because she's young, but you're watching it fill as you go, and that's the artistry of all of this stuff. And you can see the maximal light projection is becoming lateral here, lateral to the canthus. That's where I want it for her. She's a model and she likes to have that look of a little bit of flash laterally. And again, young people can take it. If there was loose skin in the perioral area, vertical lip lines, we address those first. But when everything looks very good, we can create beautiful shape and contour. The younger generation value this, and so that's why we see a lot more of the younger generation coming in versus the older generation. You can see here in the after picture that that point of maximal light reflection has shifted. Okay, now I don't want to do more lip filler for her. She asked for a larger lip. I love the shape of her lips. They're nice and red. There's not a lot of lines, but I'm going to do plasma lip. I'm going to use one opening here. This is platelet-rich fiber in her own blood product. I use one opening with a micro cannula, and I'm just going to put a couple of cc's in total here. This will go in. There's no heparin or sodium citrate in here. Her own blood products and growth factors will form a clot. That clot will dissipate over about a week, but those growth factors are going to just dissipate in to help tighten the skin. It'll create a little more pink look, and it'll give a subtle increase in volume, and it'll help that thread at the vermilion border. People love plasma lip. And here, the last final step, of course, Rajani MD Lip Plumper. Everyone loves a plump lip. This is going to hydrate, add peptides, give her long-term results of just a rejuvenated look, and it can be applied every 3 to 4 hours. And we know when people stop it after using it for 30 days, the lip stays larger for another 30 days, and that's from that peptide in the product. So let's take a look at the after picture now. So here you can see in the before and after, just a rejuvenated look, a slightly more open eye. The lips are a little more shaped. We've created with that cheek filler a narrower looking face with a more defined, higher cheek. And that just gives an overall refreshed, rejuvenated look. So I said we're going to dive into pricing. Let's look at that. Before I do, let's look at valuing this. A lot of people will buy a new car, $100,000 car, get a new kitchen, $100,000 kitchen. No one sees their car. Who cares about it? No one even sees their kitchen. They'll come into our clinic and say, hey, I want to get a vial of filler. I want to pay $399. Yet they're driving a $100,000 car and a $100,000 kitchen. The rich people don't even use kitchens. They eat out. So when you think about money, the younger generation, they figure they can't afford to really buy nice cars, and they Uber around. Much smarter. They don't think about buying homes because we've priced them out of the home market and they owe $400,000 in student debt. So they value the aesthetics, and that's partly why it's all over Instagram, it's all over Facebook, it's all over YouTube. It's a shift in the thinking about where they're putting their priorities. They're into themselves, trips into valuing traveling around the world. They've traveled around the world before they've even gone to university. So it's just a different shift, but what would this cost for someone? If you break it down, let's see, we did neuromodulators, say a couple $100. Threads, let's say $300 countrywide pricing, so we're at $500. If we then add a half vial of cheek filler per side, say $800, so we're at about $1,300. And then let's add the Plasmalip, another $700 roughly, so somewhere around $2,000. And that would be an average pricing. Something like Plasmasculpt is $3,000 to $5,000. So when you think about pricing of these services, you get an idea of what a combination treatment might cost, but the results you get are going to be far superior than if you come in to get a little bit of Botox or half a vial of filler here and there, or a microneedling treatment. If you come in and package these things together and treat the whole face, you need less over time when you prop up your baseline. So it's a whole different shift. I'd love to hear what you think about it. What's your thought about the whole aesthetic industry? Have you had a combination procedure done? Do you value it? What do you think the difference is? Why the youth value it, yet people who are a little older, my age, are way behind and haven't valued it. So thanks for joining me for this YouTube video. Very interesting stuff. Join me on this YouTube channel over on Instagram to keep your skin and body beautiful, healthy, vibrant.